Hi, I'm Cesar Paro, a PhD student in public health at Federal University of Rio de Janeiro. I was a West PhD student at Global Health section at the University of Copenhagen from last September to February 2020. I came back to Brazil 1st March when we had already officially registered the first infection with corona. I live in Rio de Janeiro City, the second most affected place in Brazil after São Paulo City. First of all, a brief contextualization. In this video, I will tell you about the national situation, and sometimes I will highlight some details of Rio de Janeiro's situation. It's very difficult to give an overview of Brazil because we are a vast country with a population of more than 200 millions and an area rather equal to the whole of Europe. We are a federative republic with the union level, 26 states plus the federal district, and more than 5,000 municipalities. Those three levels of governance have the challenge to develop our public universal health system that we call SUS, the Brazilian acronym to Unified Health System. Each level of governance has its specific responsibility and also relative autonomy in the management of the system, because our constitution establishes the distribution of power between levels. That is important to understand because the response to COVID in each territory of our country will depend not only of our president, but also on our seats majors and states governors. We hope they will interact in a cooperative federalism to develop all the actions and services that a health system needs to have. However, the union level receives a bigger proportion of public taxes. In practice, this means that the union usually has a more significant power to induct how the levels below will work and put in practice the health policies. Despite the cooperative assumption between the levels, we are having a massive problem of governance between them. We are having more competition than cooperation. On one hand, we have the national level that is not considering some of the World Health Organization recommendations because our president thinks that economy cannot stop. On the other hand, we have majors and governors advocating for the quarantine and the stop of non-essential activities. These scenarios make people confused about what they need to do. While the media and local levels say to stay home, keep safe, our president goes to the television and says that they are making hysteria. The major and governors are making hysteria because corona is just a little flu. Therefore, he's assuming that we don't need to stop our activities. We can stop the economy. We need to go outside and work. This kind of speech we have by our president. Let me present you some updates numbers from yesterday, 20-30 April. We are near of 50,000 confirmed cases. We already have more than 3,000 deaths, and this means lethality near 6.5%. But we need to have a critical view of those numbers. The tests are not available to everyone due to the costs of the test and also the reduced availability of the material and laboratory. We are only testing severe cases and health professionals. Therefore, we have a huge sub-notification in those numbers. Nowadays, some municipalities are able to buy more tests, and they are doing a more massive strategy to test other groups. It's also important to highlight a pioneer and large populational study that we are doing in Brazil. The research project EPIV COVID-19 is coordinated by the Federal University of Pelotas by the epidemiologist Cesar. They are at the beginning of the study. However, they already have the results of Rio Grande do Sul situation, a state in the south of Brazil. They showed that the number of COVID-19 cases is 7 more times higher than that officially registered at the end of March. Our first cases were confirmed at the end of January. The virus was imported by people who came from countries in an epidemic situation. On the second week of March, we already had a scenario of local communitarian transmission. Nowadays, we have the spread of the virus to the whole country with different intensities. All the states have already registered at least one death. At the beginning, the virus affected welfare Brazilians who can afford to travel abroad and pay for treatment in private hospitals. So, the virus began at the top, but it already at the lower social levels. The virus is already inside favelas, the virus is already inside indigenous tribals, the virus is already inside some tiny communities. The poverty associated with the lack of investments to social justice for some groups in Brazil brings more challenge to some groups how to deal with the quarantine and have access to a quality health care. I will bring here a narrative that shows those challenges. It is the story of our first death in Rio de Janeiro state. It is the story of a 63-year-old black woman that lived in a city 100 kilometers far from the capital here, where she had been working as a housekeeper for 20 years. Her employer, that lives in one of the most wealthy neighborhoods in Rio de Janeiro city, had gone to Italy for carnival holidays and come back with corona symptoms. The employer didn't ask the housekeeper to stay at home, neither told her about the illness. Unfortunately, the housekeeper had already diabetes and hypertension and was contaminated by her employer. Her relatives came to her job and took the housekeeper to a public hospital. The information about the employer's infection came too late, and the medical staff could not give the best assistance. This black woman died. Our first death is not the rich people that came from Italy and China and other countries. It's a housekeeper. Although we have a universal and free health system, welfare people prefer to use the private sector due to the problems that we have with the implementation of our public health policy. Almost 75% of the population depends exclusively on the public system, and 25% of the population has some kind of health insurance in the private sector. If we take a look at the number of intensive care beds, we can see the difference between those two groups. We have a proportion of 2.2 beds to each 10,000 people in Brazil. However, only half of them are public beds. Although that proportion respects the World Health Organization's standards, If we take a look at the distribution between our regions, we can see that 8% of the health regions don't have at least even one bed each 10,000 people. We still have areas without a single bed. Those scenarios show us the inequality on health access in Brazil. It is mainly caused by the chronic subfunding of our public health system during its 30 years of existence. Although a lot of pressures from social movements that advocate for the right to health, we still could not achieve the implementation of the system we approved in our last constitution in 1988. But things are coming worse. Few years ago, we approved austerity package to freeze social spending for 20 years, including new investments to health sector. In the most affected areas of Brazil, like Rio de Janeiro, we already have been limited access to adequate medical care. Field hospitals have been constructed to increase our capacity. The social movements are suggesting the importance of the government establishes one single line of access to intensive care beds. Therefore, the private and public beds could be better distributed between all people that need access to intensive care beds. The name of this movement is Equal Lives, and it is regarding that need of access for all population. By the 2 last weeks of March, we closed our air and land borders. Only some categories can enter now in the country. We also had a reduction of international flights and in-country travels. We closed all non-essential business on March 24. This measure began early in some municipalities, and only markets, drugstore, gas station, health services, and other essential public services can stay open. As more than 40% of the active population works informally, poor people are suffering a lot. They earn what they eat in the same day. The financial government help took a long time to be created. Now we have an emergency program that gives money. This amount is a half of one minimum salary per person. However, a lot of people have not received this benefit yet. Therefore, due to the government inaction, activists inside the poor neighborhoods and a lot of institutions are promoting donation campaigns of money or materials. They are trying to feed the families and allowing them to have basic coronavirus materials of hygiene and prevention. A great amount of the population has difficulties to put into practice some of the quarantine recommendations. It's impossible to avoid contact with sick people in some poor neighborhoods. Some people live in overcrowded conditions and lack proper sanitation. To have clean water do not exist for a lot of people, mainly who lives in favelas. We are having we have very punctual initiatives in some municipalities, like to have some place to homeless stay in this period. We also have some initiatives to invite risk person that lives in favelas to stay in a hotel in this period. But all those initiatives could not achieve a, a very great amount of people that need this kind of initiative. So I would like to say thank you for the University of Copenhagen to for to invite me, and I'm here to keep in contact with everyone that want to talk about Brazil's situation in COVID period. See you. Thank you. Bye bye.